Ẹ̀bùn pàtàkì lọ́mọ bíbí, ìyá àbúrò kú ewu. Ẹ̀bùn pàtàkì lọ́mọ bíbí, ìyá àbúrò kú ewu.
The term Abiye was coined to describe a concept of safe motherhood that can be easily grasped by the people in the rural area of Ondo State, southwest of Nigeria, where over 75% of the population work and live. The project is also an attempt by the Governor Olusegun Mimiko-led administration to reverse the high rate of infant and maternal mortality.
The Abiye literally means safe delivery. It is basically to address the reason why women die in pregnancies, which has to do with the delays. Abiye goes beyond a name. It is like a wish. It is even more than that in a country or in a continent where women die as a result of pregnancy and pregnancy-related problems. It is to reverse the ugly statistics.
The World Bank indices of 2008 placed Ondo State as having the worst record of maternal mortality among the 6 states that constitute the southwest Nigeria.
We are very concerned about the health indices that we have in Nigeria. Nigeria is one of the worst health indices in the world. 1 in 10 women die every year in Nigeria from preventable diseases. We lose 1 in 4 children before the age of 5 every year from, again, preventable diseases. So when we came to Ondo, we were talking with His Excellency, and we informed him that Ondo actually has one of the worst health indices in this zone.
World Bank actually did declare Ondo State as having one of the worst health indices in terms of maternal mortality and under 5 mortality. However, the government and the governor of the state was mindful of the promises to the people of Ondo State when he actually said in the health sector he would provide exceptionally qualitative health care which will be affordable and will equally be accessible where they live, where they work and where they play. And again, coupled with this unflattering statistics, it became imperative that we have to then reform the health sector, and we need the need for us to do a true primary health care approach.
From the perspective of Governor Mimiko and his team, a homegrown strategy that will touch the lives of the common people is necessary to address these challenges.
First, to ensure that maternal and infant mortality is brought down drastically within the next 2 to 3 years in Ondo State. And we think we can do this, 1, by ensuring training and retraining of our health personnel. We want to ensure that every pregnant woman in Ondo State has access to skilled personnel wherever he wants to deliver. That point of delivery, that access to skilled personnel. And where there's emergency, that the services should be so organized that including ambulance services, including referral centers that such patients will have access to referral services.
Experts identify the causes of high maternal rates to delays in seeking, accessing, reaching, and getting health care. Women in the rural area are more prone to this delay. To address the first delay, the Abiye project embarked on an enlightenment and education program for pregnant women on the dangers of patronizing unsafe places for delivery. Abiye also tackles the second delay by providing transportation for the health rangers.
It is looking at the delays leading to maternal death. And the first delay has to do with the delay in seeking health care. The second delay is the delay in reaching health care. The third delay is the delay in receiving health care. And the last delay is the delay in referral. Each component of Abiye is basically meant to address each of these delays. We have the advocacy and sensitization, which is getting the people to be aware of the burden, the huge burden, the maternal death occurring and the death of the children under 5. We piloted this program at one of the local governments, a very compact local government in the state, called the Federal Local Government, with a very sizable population. And at the pilot, we actually did the sensitization advocacy, after which we then embarked on the baseline survey. Significantly, what came out of the baseline survey was the fact that only 16% of those that will come to register in the hospital will eventually come to deliver, right in there. That then explained why we have high maternal mortality, because 84% will have gone to deliver elsewhere. And knowing fully well that the most critical moment in a woman's during the pregnancy is the time of delivery, where we require a very skilled birth attendant to take care of that delivery. And so it gives us an insight into the problem. So the component of Abiye, which is basically to address the delay, the first component, which is the health rangers, they are community health extension workers. They are meant to establish rapport with the pregnant women. During the baseline survey we did, registered about 1,217, assigned to 50 of these health rangers, and each health ranger will be looking after 24 pregnant women. And the purpose is to establish rapport with them. Then they go with the customized checklist, and the checklist is basically to enable them determine and detect the women that are of high risk. And those that are of high risk are given attention. They ensure that they come for regular antenatal care. And they ensure that they do for them what we call the birth plan and complication readiness. And these and other things that the health rangers, other things they do have to do with nutrition in pregnancy, demonstration of insecticide-treated nets, all other things like health education, family planning, and all of that. And all of them are equipped with a motorbike, which will enable them move around in the rural community. And each one of them have what we call the mobile phone, the Abiye phone. And all the pregnant women in the registered under Abiye were given mobile phone, and each mobile phone has they are connected via what we call the CUG, which is the the closed user group. And the closed user group is toll-free, prepaid, by the government, to ensure that at every point in time they do not have difficulty in reaching their health care, and the healthcare provider too do not have difficulty in reaching them. So the issue of communication is eliminated, and this equally helps in ensuring that the second delay, which is the delay in reaching healthcare, is taken care of, as each of the basic health center established under Abiye, equally distributed all over the pilot local governments, have what we call tricycle ambulance, and the comprehensive health center has the 4-wheel drive ambulance. At every call of the pregnant women in distress, a call is put through to their health rangers, and health rangers put a call through to the ambulance to get them evacuated for intervention. And so it makes it essentially important that the delay in seeking health care and the delay in reaching health care is taken care of, and which leads to the third delay, which is the delay in receiving health care.
The solution to the delay is to upgrade and renovate health facilities and also equip the Abiye health centers.
The delay in receiving health care, in ensuring that each of these in each of the zones we have basic health centers, like I've said, and we have the comprehensive health centers located in each of the zones. Each of the basic health centers are equipped, and they were equally staffed with trained healthcare providers. They've been trained on integrated management of childhood illnesses and basic obstetric care and care for the newborn. And each of them, they are able, to handle normal delivery, including because of the midwives that are present in each of these the basic and the comprehensive health centers. In the comprehensive health centers, we have doctors present there, while the basic health centers have the midwife and the health rangers referring patients to the midwife. And drugs, consumables, all of that have been provided in all of these hospitals to ensure that at every point in time that a pregnant woman gets to that hospital, they receive their care. And for cases that are beyond the control that they couldn't manage, from the basic health centers, referral is being made to the comprehensive health center. From comprehensive health center, we have referred to the general hospital, as the case may be. And from general hospital, they are being referred to the mother and child hospital. And so that enables us address the delay in receiving health care and the delay in the referral. And it's a two-way referral. Information regarding the management at each of these referral centers is being communicated back to ensure that it helps in advancing the care where the referral was initiated. And it has been, a very wonderful experience, as the result has been quite exciting.
The success story, according to the governor, has been made possible through partnership with the World Bank, cooperation with the people at the community level, support of community leaders, and cooperation of the beneficiaries, as well as the competency of the healthcare providers.
The several months of toiling have now resulted in the delivery of accessible and quality healthcare services to the citizenry. The baseline survey carried out at the federal and local government, among others, revealed that out of 2,989 that registered for antenatal care, only 432 actually delivered at the clinics. This represents just about 16% of registered patients. However, since the inception of this program about a year ago, November 2009 to November 2010, 1,033 deliveries have been recorded out of about 3,000 continuously registered patients. That means a minimum of 35%, which is already double the baseline percentage. And when you take the percentage of those who registered that were already due for delivery, the percentage is more than 90%.
Testimonies from the beneficiaries of the Abiye program reaffirm that this homegrown strategy of tackling maternal mortality is already making impact. The Baale of Owena, Igbalauke, one of the rural areas benefiting from the Abiye project, and his chiefs undertook independent inspection and facility tour of the Owena Abiye Health Center.
Very standard.
Very standard.
That's wonderful.
It's a highly work.
Before it was it was a problem because you have to go a long distance, about 6 kilometers to Igbaroke, before they can get medical attention, proper medical attention. But now, since the coming of this project here, things are easier now. Everything is perfect medically.
At each Abiye Health Center, there is provision of water supply, regular electricity supply backed up by automatic generating plants in a conducive environment. The healthcare providers enjoy enhanced salary package and are well motivated to perform their duties professionally.
Ilara zone comprises of comprehensive health center Ilara Mokin, basic health center Ilara, basic health center Ibule, and basic health center Ipogun, in which we are now for the whole zone now. And presently